Oral and Maxillofacial Surgery, 2nd edition, edited by Lars Andersson, Deepak G. Krishnan, and Zachary S. Peacock, was published in 2025 by John Wiley Sons. The first edition dates from 2010. Its primary field is oral and maxillofacial surgery. The editors identify postgraduate students, residents, and specialists as the main audience. The aim of the book is to cover almost the entire contemporary scope of the specialty, from preoperative assessment and anesthesia to implant dentistry, infections, tumors, reconstruction, trauma, orthognathic surgery, temporomandibular joint disorders, and facial cosmetic surgery. Because of this breadth, it should be read as a reference textbook rather than as a single clinical guideline. The book is organized into 9 sections. It begins with basic principles, medical assessment of the patient, emergencies, anesthesia, instrumentation, and radiographic imaging, and then proceeds to dentoalveolar and implant surgery, infections, head and neck pathology with reconstruction, trauma, dentofacial deformities, orofacial pain and temporomandibular joint disorders, concluding with facial cosmetic surgery. The structure is logical, but because of the enormous range of topics, the book is not uniform in depth. Some chapters function almost as independent clinical manuals, while others provide more of an overview of their respective fields. The scientific value of the book is high, but not equal across all chapters. For the 2nd edition, new authors and new chapters were included to address developments in the specialty over the 15 years since the 1st edition. The literature includes systematic reviews, meta-analyses, randomized controlled trials, guidelines, cohort studies, and older key sources. However, a large number of references is not the same as a high level of evidence. This is a multi-authored textbook, and the quality of the evidence base depends on the topic. The authors openly acknowledge this in several places. In the chapter on antibiotics, they state that the evidence for certain prophylactic indications is limited and that some recommendations are based on clinical reasoning and experience. In the chapter on discontinuation of antiresorptive therapy before invasive procedures, they emphasize that the benefit of a drug holiday has not been reliably demonstrated and that global consensus has not been reached. The chapter on third molars is particularly well done. It does not reduce the decision to the question of whether or not to extract, but considers natural history, pathology, systematic reviews, guidelines, risk assessment, patient preferences, and active surveillance. The book presents arguments both for non-intervention and for selective earlier removal of teeth associated with an increased future risk. The most clinically important message is that the decision must take into account the position of the tooth, its relationship to adjacent structures, the possibility of future pathology, the patient's age, the expected morbidity of surgery, and the patient's informed preference. The argument is relatively convincing, but some of the evidence comes from older and heterogeneous studies, so the recommendations should not be converted into universal rules. The book itself emphasizes that guidelines must be periodically reassessed as research, treatment options, and patient preferences change. Another practically important area is antimicrobial therapy. The authors clearly reject the use of antibiotics as a substitute for accurate diagnosis, drainage, and appropriate surgical treatment. A localized infection without systemic spread often does not require antibiotics, whereas a serious infection with airway compromise or spread into deep spaces may require hospitalization, intravenous therapy, and initially broader antimicrobial coverage. For prophylaxis, the book recommends selective rather than routine use and states that there is no high-quality evidence supporting continuation of prophylaxis beyond the day of surgery. The specific choice of medication and dosage should be checked against current local guidelines. A third important topic is medication-related osteonecrosis of the jaw. The book uses sources and position papers published through 2023. Patients receiving antiresorptive therapy should be assessed individually. Good oral hygiene and follow-up have preventive value, and routine discontinuation of therapy before extraction is not presented as having proven benefit. The authors state that the evidence supporting the benefit of a drug holiday is weak and that the issue remains without global consensus. A fourth clinical example is Peri-Implantitis. The book emphasizes biofilm control, removal of plaque retentive factors, assessment of smoking, diabetes, and previous periodontitis, as well as the need to maintain good oral hygiene and regular follow-up. It also states that the heterogeneity of laser protocols does not allow a conclusion regarding additional clinical benefit. However, some formulations, such as broad recommendations for augmentation of keratinized mucosa, sound more definitive than would be desirable without a clear presentation of the level of evidence and should therefore be interpreted cautiously. For everyday practice, the book is strongest where it connects diagnosis, treatment selection, and prevention of complications. The chapters on infections contain differential diagnostic principles and checklists for treatment failure. The chapter on third molars includes assessment of difficulty, referral, and informed consent. Orthognathic surgery emphasizes systematic clinical and radiographic examination and realistic patient expectations. Trauma and traumatic dental injuries emphasize the importance of early and appropriate emergency intervention. The book offers concrete clinical steps, tables, illustrations, radiographic images, and operative principles. Its greatest strengths are its exceptional breadth and integration of dentistry with medicine, radiology, oncology, and reconstructive surgery. Its strong visual and procedural character. Its open acknowledgement of uncertainty when the evidence is weak. Its inclusion of contemporary topics such as virtual surgical planning, patient-specific implants, and digital workflow. And its consistent focus on clinical decision-making, risk, and communication with the patient. Its weaknesses are also clear. As a multi-author book, it does not have a completely uniform style or a single system for grading evidence. Readers often have to distinguish for themselves between a recommendation based on a systematic review and one that is primarily the result of the author's experience. The literature is highly current in some chapters, while others depend substantially on older classic studies. An older source is not automatically weak, particularly for anatomy or the history of a technique, but it becomes problematic when it forms the basis of a decision in a rapidly changing field. Practical algorithms are present, but they are not equally represented throughout the entire book. The book is generally very current, but no textbook of such broad scope remains completely up to date in every subspecialty. No separate external systematic literature search was conducted for this review, so it is not claimed that every recommendation has been independently confirmed as the latest standard. Based on the available sources, this cannot be reliably assessed for every individual topic. For dental students, the book is excellent for understanding the breadth of the specialty, but it is too extensive to serve as a basic textbook for initial learning. For younger dentists, the chapters on patient assessment, dentoalveolar surgery, infections, and trauma are the most useful. A general dentist will not use every section, but will gain a very good reference source for determining when a case exceeds the boundaries of general practice. Residents in oral and maxillofacial surgery benefit the most because the book combines breadth, technique, and complications. For specialists and faculty members, it is valuable as a reference and teaching resource, with the proviso that the most recent guidelines should be checked for narrowly defined clinical decisions. The three most important professional concepts are as follows. A good operation cannot correct an incorrect indication. Patient assessment, diagnosis, risk evaluation, and planning must precede technique. Surgical maturity means recognizing the limits of the evidence and being prepared to choose observation, a conservative approach, or referral rather than performing a procedure at any cost. Prevention of complications is not a single maneuver in the operating room, but a process that begins with medical history and imaging, continues through procedure selection and aseptic technique, and ends with follow-up and clear communication with the patient. Does the book deserve a place in a professional library? For residents and oral and maxillofacial surgeons, yes. For general dentists who want a serious reference source, also yes, although it is not necessary to read it from the first page to the last. I would recommend it most strongly to residents and younger specialists. A dentist who does not practice surgery and needs only a concise practical manual can reasonably skip it. Its greatest value lies in connecting an enormous clinical scope with operative reasoning and contemporary developments in the specialty. Its greatest weakness is the uneven level of evidence and depth across chapters. It is best used as an advanced textbook and reference manual rather than as the sole clinical guideline. If you ask me as a colleague whether it is worth the time required to read it, the answer is yes, particularly if you are seriously studying or practicing oral and maxillofacial surgery and approach the book selectively and critically.